Hello, I am going to demonstrate how to APGAR score a newborn infant. For the purpose of this demonstration, obviously this is a fake baby, and this is, however, a real labor and delivery warmer that's traditionally used in labor and deliveries everywhere. What we do like to do after a baby's born is put the baby on the mother's chest. However, for purposes of this demonstration, we're going to use the warmer for all of the APGAR scoring. So what APGAR score does, it assesses how well the baby's doing at 1 minute of life and again at 5 minutes of life. The things that we assess for our heart rate, and how we check for that is we feel at the umbilicus for the heart rate itself. There's still a pulse there, and we can actually feel it. The 5 minute, that's not the best way to do it. You usually use a stethoscope for the 5 minute APGAR because not every baby has a pulse that you can tell, exactly what it is. You might feel some faint pulses, but nothing that you could really count. We also look for respirations. We want to make sure the baby is actively crying, that when we know the baby's breathing, we want to see how well the baby's color is changing as well. That's directly related to the breathing. I'll go over more color in just a bit. We're going to look for muscle tone. We want to see if the baby's limp, if the arms are flexing, or if there's active motion going on. The fourth one is reflex irritability, or also sometimes you'll see it listed as grimace. I'm looking for no response, or a facial grimace, or just vigorous movement. And the last one is color. We want to see if the baby's pale, which will give the baby a poor score. Blue, another poor score. Pink with a little blue, or pink all over. Those are the things that we're looking for. So after the physician hands me the baby after they're born, I am going to start, once the baby is born at time of birth, I hit start. And this starts from time of birth, and at 1 minute it will beep, and it will give me the APGAR score. So during this minute, sometimes the baby is still in the doctor's arms, sometimes they're clamping the cord, sometimes they're suctioning the baby, they're doing all these different things in 1 minute. And as soon as I get the baby over, which is usually about 30 seconds or so of life, I'm starting my assessment. I am looking at limbs, I'm seeing if the baby's reflexive, obviously seeing if the baby is breathing. I'm doing all of these things at one time, and I'm going to go over in more detail each individual thing that I'm looking for. But it is like when you do a full assessment on someone, you kind of look at everything as a big picture. So since it's almost a minute, I'm going to start feeling for pulse. And I'm feeling right here where the umbilical cord, on a live baby, there is a section of cord that's still there and clamped, and I can feel what the pulse is. And so I'm going to count, and I'm going to look at the clock. So once it hits a minute, we'll start counting. And we'll count for a full minute to see exactly what that is. And while I'm doing this, I'm going to be looking for respirations. So is the baby pink? Is the baby crying loudly? Is the baby doing all those things that it should be doing that's letting me know that he is breathing? If the baby is limp, if the baby is slow and the respirations are irregular, the score would be a 1 in the APGAR scoring. If the baby is crying loudly and everything looks good, the score will be a 2. So right now I'm going to give this baby a score of a 2, because if you could hear this baby, it would be crying very loudly. I'm looking at muscle tone. The baby there's some flexion, it's not super active, and so I'm going to go ahead and give this baby a 1 for the 1 minute APGAR score. He's grimacing, his face is grimacing, but he's not vigorously moving, so I'm going to give him another 1 for grimace or reflex irritability. His body, he's not pale and he's not blue all over. His extremities are blue, but his trunk is pink, and so he's going to get a 1 for color. His heart rate, now that I've checked it for a full minute, is greater than 100, so he's going to get a 2 for heart rate. So when we add these things together, a perfect APGAR score is 10. So most babies do not have a perfect APGAR score of 10, either at 1 minute of life or at 5 minutes of life. Usually the baby will have points taken off for color. Sorry, these things are kind of loud. So the next thing we'll look for, because the 5 minutes, right now we're 4 minutes and 45 seconds old, and so we're going to start looking how the baby's doing at 5 minutes of life. So I'm going to check the heart rate again. This time I'm going to use the stethoscope because the pulse will be too faint in the umbilical cord. So I'm going to listen and count. So now we're at 5 minutes of life. And the baby's heart rate is still greater than 100. And so I'm going to give the baby a score of 2 for heart rate. The baby's respirations, he's still crying loudly. He's going to get another 2 for respiratory effort. He's actively moving around. He's kind of getting irritated. He doesn't want me messing with him anymore, so he's going to get another 2 for muscle tone. The baby's vigorously moving, and he has, the facial expressions, everything we're looking for, so he's going to get another 2 for grimace and reflex irritability. And now his color, the thing that we typically take off for at the 5-minute APGAR is he's still not perfectly pink all over, which is absolutely normal in babies. However, I'm going to go ahead and take off 1 point for that and give him a 1 for color. So now his 5-minute APGAR score is a 9, which is an improvement from his 1-minute APGAR score, which is 7. What this tells me is this baby is adapting well. It adapted well at 1 minute because it was greater than 6, and it adapted well at 5 minutes because it's still greater than 6 and it's improved from 7. So this baby is safe and is healthy to go over to mom, and we can now continue to monitor the baby during the transition period.